How does adequate intake, AI, help determine your nutrient dosage? Imagine a puzzle where each piece represents a vital nutrient necessary for maintaining health. Piecing together the correct amount of each nutrient can be complex, but understanding how the concept of adequate intake helps simplifies this process. Adequate intake is a recommended average daily amount of a nutrient that is assumed to be sufficient for healthy individuals within specific age and gender groups. It is established when there is not enough scientific evidence to determine an estimated average requirement, which is another measure used for setting nutritional guidelines. The process of determining adequate intake involves analyzing data from healthy populations, including observational studies and clinical research. Researchers look at the amount of a nutrient that prevents deficiency symptoms and supports optimal health. When data is limited or inconsistent, experts use this information to estimate a level that should meet the needs of most individuals in a group, while also considering safety margins to prevent toxicity. Once the adequate intake level is established, it serves as a benchmark for individuals and health professionals to assess whether dietary intake is sufficient. For example, if a person's daily consumption of a particular vitamin meets or exceeds the adequate intake, it suggests that their intake is likely adequate to support health and prevent deficiency. Conversely, if intake falls significantly below this level, it may indicate a need to increase consumption through food sources or supplements. The role of adequate intake extends beyond individual assessment. It guides public health policies and nutritional recommendations. Food manufacturers and health organizations use these guidelines to develop fortified foods and dietary plans. It also helps in identifying populations at risk of deficiency, prompting targeted interventions. In summary, the adequate intake provides a scientifically informed reference point that helps determine the appropriate amount of nutrients needed daily. It ensures that dietary choices support overall health, prevent deficiencies, and promote well-being across different stages of life.